Good afternoon. This is Dr. Bradshaw, and this is the first day of trying the flip video, and I am trying to present one view at a time to my students for RAD 1611. And so the first one that we're starting with today will be the lateral cervical view. And I want to just go through, this happens to be a digital x-ray, but it's very clear and the images are very clear. And so I want to go through the lateral cervical view, just pointing out structures. Now there are several ways that you can read a film. Some people start with soft tissue, then go to the hard tissue, and other people start with the hard tissue and move their way to soft tissue. I've even been taught somewhere along the way a process where I start on one side of the film and I read S2I until I get to the back of the film. And so there's lots of different methods. I think the key is not that one method is better than the other, but that you have a system that you look at a film. And so we're going to just sort of start at the front of the film over in this area where the collimation line, of course, is right along right here. And so you see that the film has been collimated to this part right here. We do see, of course, the teeth, the lower teeth, and the teeth roots. We see the upper teeth, and of course we see the hard palate right along here. The maxillary sinus area, of course, is right here, and the eye orbit is up in this area. On this film right here would be the Sella Turcica, and the Sella Turcica has two measurements. The first measurement is from anterior to posterior across at the widest part this way, whereas the second measurement is the S2I measurement. And my mouse just went away. Let's see if I can get that back. From S2I, from the superior to the inferior aspect. Now the normal range for A to P, anterior to posterior, is 5 to 16 millimeters, and the normal range for the S2I is 4 to 12 millimeters. The average for the A to P would be 11 millimeters, and the average for the S2I would be 8 millimeters. All right, so if we continue on looking on the film, we can see the auricle portion of the ear right here, and so that's that sort of rainbow shape right there. We can see the auditory meatus right here, this little dark hole. We see this rounded structure right here, which happens to be the mastoid process. And we, of course, then, if we start with the spinal structures, we see the anterior tubercle right here. Now this little dark space that is right behind the anterior tubercle, right in this area right here to the front of the odontoid process, is called the ADI, and ADI stands for the atlantodental interspace. Then of course you see the odontoid process is this, and it goes all the way up to right here, so that will be in superimposing a little bit of the occipital condyles right there. And so we see the odontoid process is all of this. So it's going again up to this point right here and down to this point right here. Now right in the middle of the dens area, you see this increased white rounded density right here, and that is the transverse process of C1. If you then look behind the odontoid process, this area right here goes all the way up to here, across to there, down to here, and then across to there. That is the lateral mass. And lateral masses are really weird just because they have not well-defined edges. And if you look at an atlas again, you'll see that all the edges are kind of scooped out and kind of fade to nothing. And that's because it's not a square box like a lot of people want it to be. We have, of course, right here would be the posterior arch, and then back here would be the posterior tubercle, and then this thin white line between the arch and the tubercle is called the spinal laminar junction line. And so that is the first segment of the cervical spine. We've talked about the odontoid process, which is part of C2. The body of C2 goes all the way down to here and all the way across then to here, and then back up to there. And so that is the body portion of C2. This density that is right across right here is the transverse process of C2. And back here in this area would be the lamina of C2. Back here is the spinous of C2, and that white line again between the lamina and the spinous is called the spinal laminar junction line. Now if you had a film that had a missing spinal laminar junction line on C2, that is technically called the spina bifida occulta. If you have a missing spinal laminar junction line on C1, that is called posterior spondylolisthesis. All right, as we move forward, we go down to the next segment. If we get down to C3, we have, of course, the vertebral body is here. And this density that is superimposing the body right here is the transverse process. The density that is sitting on top of the body is called the uncinate process. This section right here would be called the articular pillar. The whole thing is the articular pillar. The superior end of the articular pillar would be called the superior articular process, and the bottom end of the articular pillar would be called the inferior articular process, and the surface of this process is the facet. So when this facet meets this facet, the segment below, together you have the joint, you have the zygapophyseal joint. Whereas the joint of Luschka is between the uncinate process into the uncinate fossa. And that's commonly misunderstood or confused, but we have that the joint of Luschka is between the vertebral bodies, and the zygapophyseal joint is between the articular pillars. Now, staying on the C3 segment, this is the articular pillar. This portion is the lamina, spinal laminar junction line, and then the spinous process is back here. If I move to C4, again, vertebral body, articular pillar, lamina, spinal laminar junction line, spinous process. Now, spinuses of 3, 4, and 5, you see that they're really very, very dark, but that's because they don't have a lot of density, and it will often be trouble to find the spinuses of 3, 4, and 5 because they just don't have as much density, but you do see that they are not the same shape, they are not the same size, and they are not the same density. When you get down to about C6, then you start to see the spinous a lot better, and that's because it has more density, it's a lot longer, and so it shows up a lot better on a cervical view. If we move to in front of the spinal column, you see that the mandible, of course, is all of this. This would be the angle of the mandible right here in this area. And what is this dark that's superimposing the mandible is the airway. And the airway in front of C1, C2, C3 is called the pharynx. Now, right here in this area in front of 4, 5, airway kind of jogs forward, and that is called the larynx in front of 4, 5, and in front of C6, C7, the airway is here, soft tissue is here. Airway would be called trachea in front of C6, C7. The soft tissue that is behind the airway in front of C6, C7 is called the retrotracheal interspace. And of course, the soft tissue in front of 4, 5 is called the retrolaryngeal interspace. And the soft tissue from the back of the airway to the front of the vertebral body in front of C1, C2, C3 is called the retropharyngeal interspace.